I've really come to understand the platform, one of the things that I like to say is, look, this is a platform for innovation. When you look at an open architecture platform that really takes a sort of nowhere, SOA approach, it gives the opportunity for best-of-breed applications to work together. And one of the reasons that I like that as a physician executive is, I've run a Medicare ACO, I've been a medical director for a Medicare Advantage plan, I've been a health system CIO and CMIO in my career, is that, I don't want to be stuck with, necessarily one suite. I want to be able to leverage innovation. And I love innovation. I did my first startup in '97, and I love the whole startup scene. And that's why, I'm very fortunate that one of the things that I get to do with my free time is to spend time as a mentor in residence at Matter Chicago. Matter Chicago is a health IT incubator here in Chicago. It started this year. 90 days in, we have 80 healthcare IT startups. It's absolutely remarkable. With generous funding from the city of Chicago and the state of Illinois, and also from Pritzker Ventures, the Pritzker family, J.B. Pritzker, who is the brother U.S. Commerce Secretary. This is a great story about innovation, and the other great story about innovation is that a company like Harris would help foster this by saying, we want to have a platform where innovators can, plug into a framework and be able to have their applications run on it. And that's all we have, and we want to work with companies like DOC&I and others that you'll get to meet. But in the forefront of innovation, I get to have, a really good passenger seat to get to talk to these guys and see what they're doing. And this is a great story. DOC&I, they provide, real-time information about pharmacy cost, right at the point of care to physicians. I'm an internist, and my friends who are still practicing, I don't know how many of them say, I've got 2 dozen phone calls from patients going, I'm at the pharmacy, do you know they want me to pay $100 for this? I thought it was going to be $15. So guess what, folks? It happened to me right after New Year's. I went to pick up my son's medication. He's 8 years old. He couldn't attend today. He has class. He's in the 2nd grade, and here in Chicago. And I went to pick up his medication, and they said that's going to be $85. I'm like, what do you mean? Well, it was right after the first of the year, and the formulary had changed, and nobody had told me, I'm a member of the plan from an insurance perspective, and nobody had told my doctor. So I had to call my doctor and all of those sorts of things. Well, these guys have really done some interesting things to help solve these problems. Now, I know what some of you may be thinking, hey, we have eazyScripts, don't they do all that? I'm not going to claim to be smart enough to explain this. I'm going to let the guys who really understand this explain this to you. But Mark and Brad have, 20 years experience in healthcare and pharma. Brad's done, a lot of work in pharma over the past 20 years, came from Northwestern. Mark is a physician from UPenn, and together they brought, I think, something that, and again, innovation is something, it's almost like innovation in plain sight. It's right in front of us, and it's like, gee, why didn't I think of that? To me, that's a definition of a great idea. So I think you're going to be excited to hear about what they're doing. And again, they thank Harris again for, providing a platform for innovation, and then also providing an opportunity for some of our startups to come and talk to people, get exposure to HIMSS, and really sort of continue on their story of success. Gentlemen.
Woohoo!
First, I want to thank Dr. Franz so much for that warm introduction. When Mark and I started at Matter a couple months ago, and they introduced the different mentors available, Mark and I immediately turned to each other and said, Dr. Franz, that's going to be our mentor, and we're honored to have gotten to know him, and thank you for those kind words. And definitely want to thank the Harris Corporation for this phenomenal opportunity, and truly look forward to being able to engage with the Harris Corporation and learn more about the wonderful things you guys are doing. So to start, I'd like everyone to take a moment and think about the last prescription medication that you were prescribed. Now, in an ideal world, your physician went through many factors when prescribing that medication for you. One of these was the efficacy. How well does that product work? The second would be the safety. What is the tolerability, safety profile, side effect profile of that medication for the patient? And the third, in an ideal world, would be for that physician to know, based on your own individual prescription benefit plan, what is the cost and coverage to ensure that you'd be able to fill that medication and be compliant and adherent to that prescription drug. The problem is that we don't live in an ideal world yet. So my name is Brad Becker, co-founder of DOC&I. I have a master's in learning and organizational change from Northwestern. This is Mark Hillary, MD from the University of Pennsylvania. And as Dr. Ferrans mentioned, we have 20 plus years experience in the healthcare and pharmaceutical industry where we saw this problem day in and day out. In 2013, Mark and I made it our mission to change the problems that we saw about that lack of transparency in prescription drug pricing, and truly believe that the problem and the solution needs to start with the provider, with the doctor, at that point of prescription. So currently, every year, there's over $330 billion spent on prescription medications. The problem is that both patients and providers truly do not know the cost of those medications, coverage, preferred pharmacy networks, until that patient actually gets to the pharmacy counter, waits in line, they run their script and find out for the first time what is that cost. And so what I want to share with all of you is, who does that impact and how does that impact them and who suffers? Well, a lot of people suffer due to this lack of transparency, starting with the doctor and the staff. Significant amount of hours are spent by both doctors and staff dealing with callbacks from pharmacies, talking to insurance companies, counseling patients. In fact, when I was in the pharmaceutical industry, offices had 20% of their staff, full-time staff, dealing with callbacks. It was considered a very evil word, that callback. It also impacts patients, obviously. We know with high deductible plans, co-insurance, more and more patients are not filling their scripts because of the cost, or they're altering their medication and they're not being compliant. They're splitting pills, cutting doses, missing days. This is greatly impacting that patient's adherence. And what does that affect on us as a whole in society? That has significant impact on the accountable care organizations, the payers, the PBMs, the hospital systems, assuming a lot of that risk for the pharmaceutical spend, to the tune of $290 billion due to medication non-adherence. These are major, major problems that we at DOC&I are solving through adding transparency. Now the key with DOC&I compared to a lot of other people in the industry is that DOC&I believes the problem needs to be addressed at that point of prescription, when the physician is actually with the patient, making an informed decision and involved in that shared decision-making process. Not after the patient drives to the pharmacy, waits in line, only to find out when they first get to the counter that the medication is not covered, requires a prior authorization, that they have to have a step edit, or it's just simply too expensive for them. We believe the problem needs to be addressed before the problem starts between the physician and the patient. So what you're looking at here is a visual of the DOC&I product and some of the key benefits and features that I'm going to run through right now. One of the key features is the Medicaid tool. So at a quick glance at the screen, a physician can see what medications are on the Medicaid preferred drug list, which medications are not preferred, and alternative medications that would be preferred. In addition to that, DOC&I provides medication pricing at that patient's preferred pharmacy, the out-of-pocket costs that patient can expect to pay, as well as comparative prices at other pharmacies within a specific geographic distance. In addition to that, DOC&I also provides alternative medications. Currently, we're working with the industry standard First Data Bank to provide us with those alternative medications. So for the first time, a physician can see not only the cost of the medications he or she is prescribing, but also the cost of alternative medications. We know that many patients are taking many number of drugs, many more than 1, 2, 3. There's often patients taking 4 or 5 plus medications. And what's interesting is the price will differ for one pharmacy might have one for $10, another pharmacy for $40, and likewise, there's not one standard that one pharmacy is always the least expensive. So what DOC&I does is it provides bundle payments such that if a physician is with the patient taking 7 or 8 medications, he or she can let that patient know the best bundle price at their preferred pharmacy compared to other pharmacies within a specific geographic distance from that preferred pharmacy. DOC&I also provides, when appropriate, membership and promotional pricing for patients. So one thing that was interesting as Mark and I began to do research around the pricing of pharmaceuticals is that oftentimes the cash price and promotional price of medications is actually significantly less expensive than a patient utilizing their insurance. In fact, there's pharmacies that offer very common medications, metformin, prenatal vitamins, generic Lipitor, completely for free. And we provide that necessary information such that the patient and physician can make an informed decision and make sure that patient can adhere to their medication. In addition to that, the physician can quickly glance and see the specific selected medications that he or she chose. And what's interesting is that you'll see from the screen, the left panel there, the physician might have initially chosen one medication, but by the time he or she went through the matrix, actually chose another medication where they could see. In addition, we've actually recently integrated with another company, eazyScripts, that's here, and working with their SureScript platform such that a physician can electronically prescribe right from that one page to help their patient and have it submitted to that pharmacy or multiple pharmacies at that point of prescription. So currently, the key to DOC&I when we first started was, will physicians use the DOC&I platform? Because no matter how good the information we provide, it's truly worthless if a physician is not going to use that information. So the key to us was to have seamless integration into the physician's existing work platform through their electronic health record, such that a physician can see at a glance what those costs and coverage are, the information that's most necessary at that key critical point for the doctor. But we do know that medicine's changing, the technology is improving, and physicians are not only prescribing medications and providing refills to patients when they're sitting in their office on their electronic health record. So DOC&I has capabilities on tablets, mobile devices, such that a physician who's at home with their family, who might be on vacation, could still access the DOC&I platform, see the patient's prescription history, compare pricing, talk to that patient, and actually e-prescribe directly from that from the DOC&I platform using the industry standard SureScripts electronic prescription.
All right, so what we decided to do was walk through some real user cases, real life scenarios to display the functionality and benefits of DOC&I and how doctors select medications. In our first user case, we have Mary. She's a 24-year-old female. She's currently taking no medications. She has pretty good insurance and she's highly compliant. For the sake of illustration, we would define her as a low-risk patient. So Mary is seeing her internal medicine physician who has great bedside manner. She's quick yet very thorough. We're going to walk through how a doctor would select an acute medication, in this case birth control, for Mary on her visit to the doctor.
So this is the first DOC&I screen, and you can see the doctor's name on the top left, the patient he or she's seeing underneath.
Who am I?
And the patient's preferred pharmacy will be auto-populated through the electronic health record. However, if the physician wants to choose an alternative or different preferred pharmacy, they can do that from an easy select down menu. After that, as Mark said, this patient is currently on no medications. However, the physician is looking to prescribe a birth control agent. Out of habit, this physician goes to prescribe Yaz. The system auto-populates. Once the physician starts typing the name of the medication, they can choose a milligram and count, select enter, and the physician will be able to see instantaneously the cost of that selected medication at the patient's preferred pharmacy, as well as the out-of-pocket costs of the same medication at alternative pharmacies within that specific geographic distance that the physician chose. The doctor can also switch to closest pharmacy as opposed to lowest cost. As you can see, we also populate immediately once that first prescription was made with the alternative selections provided to us by First Data Bank, an industry standard. And if a physician selects a milligram count for those alternatives, it will immediately display the out-of-pocket costs the patient can expect to pay at their preferred pharmacy and alternative pharmacies if pricing is available. The physician in this instance sees that there might be a better option for that patient and chooses an alternative medication. They select that medication, look at the drop down to confirm that they chose the correct medication, and simply pushing that send RX will populate the e-prescription platform and auto-populate the next screen with the drug NDC number, quantity dose, as well as that preferred pharmacy, such that in just a couple clicks, that prescription can be routed to the patient's ideal pharmacy for pickup.
So for user case number 2, slightly more complicated. In this case, we have Tina, a 44-year-old female. She's on multiple chronic medications. She has a high deductible insurance plan, and she's very cost conscious. Every dollar counts for Tina. Tina is visiting her family practice physician. Her family practice physician is very hands-on and extremely engaged in every aspect of Tina's care. She really cares about Tina's bottom line and things to that nature. So Tina is seeing her physician and needs refills. Now, because of her high deductible plan where she's essentially paying cash, Tina has expressed cost concerns to her doctor. Her doctor wants to ensure that Tina will take all of her medications and that price and cost is not an issue. And we'll walk through that.
So as Mark said, Tina is taking 3 medications and is in the office for a routine checkup and refills on those drugs. The physician has the option to use the DOC&I platform in whatever is most convenient. In this case, she does not want to look at the alternatives, but simply wants to look at the bundled options and the price comparison to ensure Tina is getting the best value for her prescriptions at the best pharmacy location. So taking a closer look, you can see that of those 3 medications, there's a significant price variance of those medications for the patient compared from her initial preferred pharmacy to another pharmacy that might be down the block or just a couple miles away. And this physician is able to improve that relationship, stickiness with the patient, have that patient engagement, shared decision making, and truly add value for the patient and hospital system by sharing this information. Now what's interesting, if you look at the example there, you'll see that 2 of the medications are actually a better price at Target, however, one is a better price at Osco. So additional functionality, if the physician wants to take this additional step, is to actually look at the optimal cost at multiple pharmacies. So this is a component that the patient could have filled in through the patient portal and said, hey, if savings are greater than $20, I'm willing to drive 5 miles and go to 2 separate pharmacies. Excellent data that's very helpful for the physician who's prescribing the medication, for the hospital system, and that patient. So you can see if the physician is going to take that additional time with the patient, they can help save them additional money on their medications and help ensure that compliance and adherence of their medication.
Now finally, user case number 3 is a real world case that really hits home for a lot of physicians. Here we have Jack. Jack is a 41-year-old man who has hypertension, he has diabetes, and he has congestive heart failure. Jack has recently been hospitalized. Jack has Medicaid, and Jack has no transportation. In this instance, Jack is seeing his internal medicine physician, who is always behind schedule, who's not on time, who sees many patients just like Jack. It is critical for this type of patient, who we, for illustrative purposes, call very high risk, first stays out of the hospital and is not readmitted, and that Jack has a medication protocol before he leaves the premise or as immediately as possible. So, in this case, Jack's doctor might not have time to use DOC&I, but some other dedicated staff member who does have time needs to go through Jack's medication regimen. So in summary, we have a Medicaid patient, a patient who has no transportation, a patient who is high risk, and a patient who has been hospitalized. In this instance, there are many factors at play that the doctor and or other caregivers must consider. So in essence, DOC&I offers the functionality for Jack and his doctor to review the regimen and either A, choose a local pharmacy where the best options are there for the patient, where the doctor and the patient will most likely feel comfortable that he will pick up his medications. B, there's the option for home delivery, very key for chronic medications. Or finally, an option many don't know about, Jack can have his prescription sent to the local on-premise outpatient pharmacy where he can fill and possess his medications before leaving. This is critical for high-risk patients that must be compliant. So, for now, we've only shared surface level the value of DOC&I by going through functionality and benefits. What we're really excited about at DOC&I is how DOC&I will help to transform the future of healthcare by creating new, robust, real-time point-of-care data around prescriptions. This is very exciting to us. We really care about these predictive analytics. In the current world, everything is claims-based, lag time, downstream, retail prescription data. That doesn't really shed light upon doctors and their prescribing habits of patients. So you might wonder, what about DOC&I's data is exciting to us? Well, I'll share it going through the many verticals. For patients, DOC&I sheds light on the critical decisions in terms of what patients think about what their prescription should be and their preferences in terms of pharmacy location, etc. Perhaps more important, the providers. This is very key. With the providers, DOC&I is going to, for the first time, truly shed light upon the prescribing habits of physicians, as opposed to just what is dispensed at the pharmacy. Currently, doctors' decisions are not fully shown to the industry as a whole. What happens is claims are purchased at the pharmacy, where all we know from our years of experience in pharmacy is that this doctor prescribed this medication. Well, what about what the doctor thought to prescribe first when they saw the alternatives in real time, when they were fully informed? What did they decide upon? That's critical information that does not exist currently. DOC&I will share that information. In terms of the large healthcare systems, the ACOs, the payers, and the PBMs, in the current shift towards fee for performance, all of these large institutions are assuming high risk, and they're doing everything they can to mitigate that risk. DOC&I will shed light upon the critical information at point of care that helps keep those costs down, keep those outcomes and quality measurements up, and revenue. Very key to these healthcare systems. And finally, manufacturers. As I said, Brad and I have 20 years combined experience in pharmaceuticals. Having information, being able to pick over a doctor's shoulder, seeing what they're doing in real time is beyond absolute gold to a manufacturer trying to get their medications into the hands of physicians there, get them into the hands of the right patient at the right time. So we know this is the true value of DOC&I, and we're happy to share more afterwards.
So where we are today with DOC&I, as said, we founded DOC&I back in 2013, and it's been a long, slow process. We're starting our pilot in North Shore Health System, and we're providing cash prices, Medicaid preferred drug list formulary. We have the alternative medications, promotional pricing, We're also working with North Shore Health System to actually have their insurance benefits for their employees, as well as their outpatient pharmacy pricing, in addition to the electronic prescribing through the HIMSS and eazyScripts platform. Where we're going tomorrow is taking that next step to really complete the picture. So currently, as we shared, what happens right now is a prescription is sent to a pharmacy, the patient goes to pick up that pharmacy or pharmaceutical, and the pharmacist does not actually know the cost of that prescription until they ring that script up through the patient's pharmacy benefit manager. So typically it goes through one of the clearinghouses, MD on Relay Health, which then pings the PBM and sends that back in real time. What DOC&I is doing is moving that adjudication from the pharmacy counter to the doctor's office, doing a trial adjudication with the pharmacy benefit manager to actually be able to display preferred pharmacy networks, patient deductibles, the value of home delivery, generic options, as well as in the future, we're looking at exploring payment processing options, because we know that if a patient has paid for their medication, they're more likely to fill that medication and more likely to be compliant, and the hospital system, ACOs, would love to know this medication was written on Tuesday, it was paid for on Wednesday, and it was filled on Friday. Great metrics to be able to understand that the continuum of care for that patient. So currently, we know the environment is a mess. And at DOC&I, it's our mission to make it better. We believe we can do it. We know we need a lot of help. We're looking for help for PBMs, large retail pharmacies, and would love to talk to anyone who's here who would like to get involved in our mission to truly transform and add transparency around prescription drug pricing. Thank you so much.
Thank you.
Thank you.
Thanks again, guys. They're awesome. So, I just want to thank everybody for listening. And, my message to you is, companies like these, Matter Chicago is, a beacon for health IT innovators to come and to bring these really, really fresh ideas. I love it when I get mad because I go, God, why didn't I think of that? I've been doing this for a long time. And it's really great. And it's also really great that there are companies like HIMSS that understand that they can create a platform, an architecture that will support this kind of innovation so that we as customers, as ACOs, as healthcare delivery organizations, payers, that these type of organizations can leverage that kind of innovation and put it together to where I've been coming to HIMSS, I think this is my 18th in a row, and to really talk about saying, we've always talked even back then about having this kind of plug and play environment where we really would have best of breed working together. So the kind of infrastructure that enables that will really help foster this kind of innovation, and we can move the ball forward and sort of end the era of non-interoperability and move on to much bigger and better things that are really centered around what we care about, which is the patient. So thank you very much, and we look forward to speaking with you soon.